Hi, my name is Dr. Cozy. It's really nice to meet you. And, oof, you got yourself pretty good there. Really quickly, can I just have you verify for me your name and date of birth? Okay. And do you know where you are? And do you know today's date? Okay, good. So tell me, how did this happen? Okay. Well, I'm glad you're all right, despite some kind of torn up ears going on. Yeah, I think these are gonna need stitches, both sides. I hate to tell you. Oof. Do you have any other injuries anywhere else? Okay. Are you feeling warm, feverish, or have any kind of chills at all? Okay. How about the ears? Do they feel hot? Okay. Okay. Do you have any allergies to medication, food, materials like latex, silicone, adhesives, iodine? Okay. And do you know approximately the date of your last tetanus shot? Okay. But it's been in the last few years. Okay. 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 That's a shadow. I thought I saw a hole in the glove. It's fine. Really quickly, I just want to take some temps, okay? So I'm going to start with your forehead. Okay. Normal at 98.2. Check your ear here. Okay. A little bit elevated, 99.6. Same with that one. Okay. That there. Alright. Do your best to keep your eyes open, okay? And I'd like you to focus your gaze right there, right in between my eyebrows. Good, okay. You can blink. Don't worry. Now, without moving your head at all, I just would like you to follow my light, just using your eyes. Good, just like that. Okay. Alright, and before I put this away, we always like to check our patient's airway. So if I can have you open your mouth, I'm just going to place this on your tongue just to kind of push it out of my field of vision. Great. And I just need to see your throat. Okay. I'm going to remove my tongue depressor, keep your mouth open. And if I can have you lift your tongue for me. Good. And just relax. Okay. You can close your mouth. And I just want to listen to your chest, and then we're going to take a look at your ears. So, I apologize if this is a little bit cold. Can I have you take a deep breath for me in and out? Good. Again. Again. And one more time. And you can breathe normally. I'm just going to listen to your tummy. Okay. Everything sounds okay. Okay. I want you to tell me how tender your ears are, okay? It'll help me determine the level of numbing that we need to do. So. Okay. How about on this side? Alright, we'll get you really nice and numb then, okay? So, I'm going to start by using this cleansing spray, okay? And it does contain lidocaine, so it's going to provide some topical numbing. And then I will be injecting lidocaine to make sure you are absolutely completely numb but this is going to make that process feel a bit more comfortable, okay? Okay. So I'm going to kind of shield your eyes here. So then, I'm just going to, away from where the ears are cut, just clean, okay? So we don't introduce any bacteria. Okay. Just a little bit dry. All right. So you're going to feel it at first. There'll be a little bit of a burn, but then you shouldn't feel anything. It should go pretty quick, okay? Okay. So try to stay really nice and still for me, okay? I know. But you should not feel the next poke. I'm gonna really make sure your ears are nice and clean, okay? just gonna look with my light really quickly. Sorry. Make sure I don't see any kind of debris on the ear. Okay. And I'm going to be as gentle as I can, but I do need to look inside of your ears, okay? I need to make sure that there's no, that there's no interior damage. So, I'm going to do what I can to make this quick, okay? All right. So then let's go ahead and start prepping you, okay? So this is going to be a little bit awkward, but I'm going to be placing these fenestrated drapes. See, they have a little hole over your ears, so we can keep everything really nice and sanitary. to give you one more spray here, okay? All right. Okay. You're doing great. I know this is not what you signed up for. Okay. going to start on this ear now, okay? One more, and you're doing great. Now I've got some interesting concentration cases. Hopefully that's getting you started. Okay. Short, excuse me, short enough because I don't want it to be snagged when you change your bandage. I'm gonna go ahead and remove these, okay? I'm sure not a moment too soon. Going to apply some antibacterial ointment. So this is a silicone bandage, and I'm going to be placing these on your ears. I might have to trim them down, but these are great because they are waterproof. So at least for today, I'd like you to keep these on. And then we will provide you with instructions with your discharge paperwork to tell you how to do dressing changes, because you're not going to want to keep these on beyond today. We don't want the skin to get macerated, which is like that kind of pruniness that you see on your fingers and feet when you're in the water, because that can make it harder to heal. So, not ideal. to make sure that those were not going anywhere. Okay. Okay, so your pharmacy is the Safeway on Northeast 11th Street. Is that accurate? Okay, I'm going to be sending in a prescription for an antibiotic ointment, so a topical antibiotic. I don't want you taking an oral one just yet, not unless you see any kind of signs of infection, in which case I'm going to want you to come back in right away so we can culture and send it off to our lab for antibiotic sensitivities. With infectious areas like deep enough cuts like that, we like to make sure that we prescribe the correct antibiotic so we can avoid any kind of resistance. So I'm going to write up a script. We'll get that sent off today, okay? Okay. So we'll go ahead and get that sent in. So some things that you would like to look for, or that I would like you to look for, sorry, is if you start experiencing fever, chills, night sweats, any kind of nausea or vomiting, if the ears turn a bright, angry red, they're a bit red right now, but it would be like a very angry, severe sunburn. Or if you see redness extending like into your face, down your neck, into your hairline, that I want to know right away. Also, if you start seeing extreme swelling. Some swelling today is to be expected. If that swelling doesn't go down or it gets worse and you start seeing it getting really swollen around those sutures, come back in, okay? Also, if you see any kind of lesions, pustules, any kind of like orangey yellow kind of crusting around the sutures, again, I want you to come back in so we can reassess you, okay? Okay. If it's white and it's like a little peely, that's okay. Sometimes people can have that reaction and that's normal. We're looking for something a bit more. It's pretty unmistakable, to be honest. Have you ever had a sunburn and had it kind of blister? Yes, yes, exactly. That's what it will look like, something like that. Okay. Okay. But also, if there's anything that you just suspect might be off, go with your gut, and if you feel like you need to come back in, please don't hesitate. Even if it's just to allay some anxiety, we're more than happy to do so. Okay? Okay. So I'm going to have a nurse come in here with your discharge papers, but before she gives you those, I'm going to have her show you how to bandage the ears to provide the most optimized healing environment for them. And she'll also give you some supplies and samples to take home with you to make things a little bit easier. Okay, so you just sit tight, and it should be just a few minutes, okay? Okay. Do you have any questions before I step out? All right. Then I will go talk to her and send her in.